Hello, my name is Tyler Oakes,
And I'm Hannah Langlais.
and we'll be talking about birth controls. Birth control is a way to prevent pregnancy. There are many different methods, such as you can use medications, undergo procedures, or use devices as well. Some dosage forms that are an option are oral forms, injections, implants, natural methods, or transdermal. Some procedures that you can undergo are vasectomy or tubal ligation, and some of the devices that are available are implants, or you could also use a sponge. And we'll also be talking about other uses of birth control later on in this presentation. To get a better understanding of how birth control works and different types of birth controls I want to give a background of how the menstrual cycle works. Menstruation begins at puberty, which can start in a biological female around the age of 10 to about 16, and ends at menopause, which occurs in the patient's late 40s or early 50s. On average, each menstrual cycle lasts around 28 days and is composed of three different phases. One is the follicular phase, the other is the ovulatory phase, and lastly, there is the luteal phase. One of the key components of the cycle are the hormones that are present during each phase. There are rises in estrogen, progesterone, luteinizing hormone, and follicle stimulating hormone. These all lead to the progression through phases of the cycle. This diagram depicts the three phases of menstruation. As you can see, the first phase of the menstrual cycle is the follicular phase, which usually lasts around 12 to 13 days. During this phase, the hypothalamus secretes gonadotropin releasing hormone, which acts on the receptor on the anterior pituitary. Here is where follicle stimulating hormone and luteinizing hormone is secreted. These two hormones act in ovaries and cause follicle development, which leads to the rise in estrogen levels that peaks by the end of the phase. Now heading into day 13 and 14 of the menstrual cycle, the ovulatory phase begins. The rise of luteinizing hormone and follicle stimulating hormone triggers ovulation, which releases an oocyte from the follicle within the ovary. Once ovulation begins, this is the start of the luteal phase, which can last up to 14 days. A key feature of the luteal phase is the high levels of progesterone. This peak in progesterone provides a negative feedback on the anterior pituitary to slow down the secretion of follicle stimulating hormone and luteinizing hormone. Progesterone also causes the endometrium to thin and increases in blood supply and a rise in mucus secretion. If pregnancy does not occur, then estrogen and progesterone levels decrease and menstruation continues as normal. If pregnancy does occur, then the hormone levels will remain raised and menses will not take place, which means that you will be absent of menstrual bleeding. Now we will be talking about options for oral contraception. Pills is one form of a contraceptive that comes in blister packs, and one pill is to be taken every day. These pills give you additional hormones and thicken cervical mucus to prevent the sperm from reaching the egg. These pills can contain either a derivative of progesterone, a derivative of estrogen, or sometimes it could contain iron as well. There are different types of birth control pills that you could take. For example, there's monophasic, which means that each tablet contains the same concentration of the hormone. There's biphasic and triphasic, which tries to mimic the rising and falling pattern of estrogen and progesterone in the body. There's also different other ones as well, like extended cycle or continuous, which gives a longer cycle of the hormones so you don't experience your period. For the monophasic, biphasic, triphasic, and quadriphasic, there are varying amounts of placebo pills at the end of the pack to induce a period. There are so many options available for birth controls because every person experiences their menstruation cycle differently. Some birth controls contain iron, which is branded by the FE on the packet. This is given to patients that are at risk of developing or have iron deficiency anemia, or also given to those with heavy bleeding and needs that supplemental iron. If you can see on this package, you can clearly identify that this birth control contains iron. Also, since this product does contain the additional iron, try to stay away from other products that may contain additional iron. For those that cannot tolerate high dose estrogen, like in the normal packs, there are ones that are low dosed, which is indicated by the low on the pack. This is more tolerable and has less side effects, contains 35 micrograms or less of estrogen, and you also want to watch out for spotting. If spotting were to occur, you should reach out to the doctor and have the dose increased to the normal strength. Some of the side effects that I talked about before could be nausea, breast tenderness, bloating, weight gain, or elevated blood pressure. Some severe side effects that come from the estrogen is the thrombosis, which is a blood clot. You can also develop a heart attack, deep vein thrombosis, or pulmonary embolism. Progestin can also cause headache, fatigue, mood changes, and also breast tenderness. I also want to say that many of these effects can diminish or disappear completely within 2 to 3 months of taking the birth control, like the headaches that is caused by progestin. Also, patients should look out for deep vein thrombosis signs, which is abdominal pain, chest pain, headaches, blurry vision, swelling in the legs, or pain in the legs. There are some precautions to keep in mind when prescribing or asking for birth control. For those that are breastfeeding, who are smokers, or who have severe cardiac conditions, you're going to want to use a progestin-only birth control. You're not going to want to use anyone that contains estrogen. There's also a precaution for acne. So those that have severe acne, you're going to want to use a lower androgenic activity like Sprintec 28. And also those that experience edema or bloating, you're going to want to use drospirenone, which is a derivative of progesterone. Here is just a list of a couple birth controls on the market. There are many more available than what is listed here. In addition to using birth control to prevent pregnancy, it is also used for menstrual cramps, premenstrual syndrome, acne, anemia for those products that contain iron, perimenopausal symptoms, polycystic ovary syndrome, and endometriosis.
I'm going to take over from here and talk about other forms of birth control that are out on the market, starting with injectables. The first one that can come as an injection is DEPO-PROVERA. This is also known as medroxyprogesterone acetate. It's injected every 3 months due to its duration of action of about 12 to 14 weeks. This can be injected intramuscularly or subcutaneously. One advantage of doing it subcutaneous is that the patients can do this at home. Some common side effects seen with this injection is irregular bleeding, unintentional weight gain, and delayed fertility after the last injection. This is about a 9 to 10 month period after the last injection where fertility is delayed. There is also a black box warning for this injection due to decreased bone mass density. This means that it is probably not the best product to use for long term. The next product we'll talk about is a transdermal patch. This patch is transdermal and it goes by the brand name of Xulane. For weeks 1 through 3, you will apply a new patch once a week. On week 4, no patch will be applied, and the removal of this patch means that your period will occur. It can be applied to clean, dry skin of the buttocks, stomach, upper arm, or upper torso. Since this comes in a patch, there is greater exposure to the hormones than in an oral formulation. However, this could be a disadvantage because it could increase the risk of thrombosis. This is also not as effective in patients who are overweight with a BMI of over 30 kilograms per meter squared, which correlates to about 200 pounds. It should also not be used in women over 35 years old who also smoke. Specific side effects for this patch can include breast pain and dysmenorrhea, which means painful periods or menstrual cramps. This is because of the increased amount of serum estrogen. The next thing we'll talk about is a vaginal ring. This product, also called the NUVARING, is a generic for ethinyl estradiol and etinogestrel. This is a combination product of estrogen and progesterone. The ring is made of a rubber material and is inserted vaginally. It's left in place for 3 weeks straight and then removed for 1 week to allow for bleeding to occur. Some side effects while using this method can include spotting, amenorrhea or absence of menstruation, and unscheduled bleeding. Since this ring is not made with latex, it is safe to use in those who do have an allergy to latex. The next category we'll talk about are implants. One of the most common and perhaps the most effective type of birth control is an IUD or intrauterine device. There are 2 types, one containing copper and one containing progesterone. The one that contains copper can stay in the uterus for 10 plus years, and the one containing progesterone can stay for about 3 to 7 years. These devices are inserted and removed by a professional into the uterus through the vagina. Some advantages to these devices are that it is extremely effective and low maintenance. It does not contain estrogen, so there should be no issues with hormonal imbalance. On this type of therapy, fewer than 1 out of 100 people get pregnant in their first year of use. NEXPLANON is a different type of implant. It's subdermal in the arm and is a small piece of plastic that is progestin only. Since this is implanted in the arm, it requires a healthcare professional for insertion and removal. This small piece can stay in the arm for up to 3 years. Some side effects, however, may include changes in menstrual cycle or amenorrhea or prolonged bleeding. There is also a chance for small but steady weight gain. Once this piece is removed, fertility will return within 3 months. There are also permanent methods, which are usually procedures. The first one we'll talk about is called a vasectomy. This procedure is for biologic males at birth, where the sperm supply is cut off by sealing the tubes that carry the sperm. This is nearly 100% effective in preventing pregnancy. There are no negative effects documented on sexual performance or sex organs themselves. This can cause minor adverse effects post-surgery, such as blood in the semen, swelling, or mild pain and discomfort. This can be reversible, but it is not advised. The next one we'll talk about is tubal ligation. This is for a biologic female where the fallopian tubes are cut, blocked, or tied to permanently prevent pregnancy. This can be done anytime, including during a birth or C-section, or after childbirth, or if you do not want to have children at all. Post-procedural side effects can occur, such as abdominal pain, fatigue, and bloating. This procedure cannot be reversed. Perhaps one of the most important topics we'll talk about today is emergency contraception. As many of you recognize, Plan B is one type of emergency contraception. It contains 1.5 milligrams of levonorgestrel and can be used within the first 5 days of unprotected sexual intercourse. Its effectiveness does diminish over time, so the sooner you take it, the better. It is preferable to take this within 12 hours of having unprotected sex. If taken within 24 hours, it is 95% effective, and within 48 to 72 hours, it is 61% effective. The way that this medication works is prevents and delays ovulation and thickens the cervical mucus. It is available over the counter. One main side effect of this medication is nausea. It is common to vomit up to 2 hours after taking this medication. If that does occur, the patient should repeat the dose. You can take an antiemetic or anti-nausea medication beforehand if this has happened before. If you are able to see a provider and get something like Zofran or ondansetron, that would be beneficial. Or if you are strictly sticking to over-the-counter, something like Dramamine could be beneficial as well. There is no limit to who can buy this or how many you can buy. Ella is another form of emergency contraception. It contains 30 milligrams of ulipristal acetate and can also be used up to 5 days after unprotected sex. This delays ovulation, but does require a prescription to obtain. Some side effects can include headache, nausea, and abdominal pain. Although this may be beneficial for emergency contraception, it is limited in that it can only be used once per menstrual cycle. When comparing Ella and Plan B, it is more effective if used longer than 72 hours since sexual intercourse. It is also efficacious in overweight patients with a BMI of over 25. Earlier in the presentation, we talked about IUDs as implants. However, copper IUDs can also be used as emergency contraception if it is inserted within 5 days of unprotected sex. This is a second-line method, but is actually the most effective. Its estimated failure rate is less than 0.1%. It still has the same mechanism of impaired fertilization and implantation. We will also go over other methods that do not fit into any of these other categories. The only way to prevent pregnancy 100% of the time is abstinence, or refraining from sexual activity. There can also be something called periodic abstinence, where you use the knowledge of ovulation schedules to refrain from sexual intercourse at the time of ovulation. There are also some other methods such as a female or male condom, withdrawal method, a sponge, and a spermicide that can be used. Most of these are available over the counter and are not very expensive. This concludes our presentation. If you do have any questions, please feel free to reach out to myself or Tyler. Thank you.
Thank you.